Alright, so now that we've been able to start the IV, we're going to look at using that to administer some medication. So some of the medications that we have at the AEMT level are Narcan and our D50. Out here I have kind of some examples of some other medications. When you get ready to test and take your National Registry exam, you will see all of these medications out there. You have to be able to figure out which one is the Narcan, which one's the D50, right, so that you can grab the appropriate medication. So for today's scenario, I'm going to be administering Narcan. Alright, once again, if you want to try and follow along on your National Registry psychomotor exam sheets, you can. However, you will notice that the procedure itself, I perform a little different as far as the exam sheet says to stop flow when you administer. Well, when you're giving medications like Narcan, you actually want to leave the medication running at least at a TKO. That way the medication is being pushed into your patient and we're not just flushing the whole lot of medication at once, right? Especially when we have a medication that is supposed to be a slow push, like our Narcan, right? As I get ready to perform this, I'm going to go ahead and ask my patient if they have any allergies, right? I want to confirm that they're not allergic to this. I know it seems kind of silly when we talk Narcan, because what's our patient going to be? Probably unconscious with depressed respiratory drive, bradycardia, bradyapnea, hypotension, right? So they're kind of out of it. But we want to make sure we get into the habit of asking our patients whether they have any allergies to medications. Or in this case, asking the patient's family. Alright, so I'm going to go ahead, from my pile of meds here, I'm going to select the appropriate one. So here I see that I have my Naloxone, right? So I may say Narcan, and Naloxone are the same medication. And then I'm also looking at the concentration of the medication that I'm grabbing. This box says 2 milligrams per 2 milliliters, so it's a 1-to-1 ratio. Alright, so we're going to go ahead and open up our medication. I'm going to assemble it. So as I pull the medication out, I want to once again verify that the medication is Naloxone, which is what I was looking for, and that it is 2 milligrams in 2 milliliters of fluid. I know I'd hate to think that they packaged it wrong, but we always want to re-verify that we have the correct medication. Okay, so to assemble our medication here, I'm going to go ahead and pull the yellow cap off the back of the syringe. The red cap will come off of the Narcan. Now, if you have a different concentration of Narcan, because it does come in 0.4 per milliliter, it'll have a purple cap. Then we're going to go ahead and slide that in place, give it a twist to seat it. And then now, as I look inside, I can see that there's a little bit of air, so I want to make sure that I dispel, right, loosen up the cap here, and dispel the air so that we're all set. So I'm at the 0 now, and we're ready to administer our medication. Alright, so we already have this line going, as if it were running into our patient. So I'm going to turn on the fluid up to my TKO here. Alright, so I'm going to go ahead and make sure that I have my BSI on. And then my injection site is going to be up here into the port. So I'm going to go ahead and grab an alcohol prep pad, and we're going to clean the medication port. And once again, give it just a moment to dry off. Okay, I'm going to reaffirm that I do in fact have Narcan or Naloxone. Okay, Narcan is a slow push medication, so I'm going to administer it over about 15 to 30 seconds, watching for a patient response. So depending on your protocols, you may have some differentiation in the dosing. In particular, my protocols are 1 to 2 milligrams titrated to effect. So as we look at our medication, I've reaffirmed that it's Narcan. We're going to go ahead and attach it. Now I know your sheet says to stop the flow. However, with Narcan, because it's a slow push medication, if I stop the flow, the medication is going to be trapped here and never actually make it to the patient. That makes it very difficult to watch for effect. So with Narcan, I'm going to leave the drip set going at TKO, and then I'm going to go ahead and slow push my medication. Like I said, over 15 to 30 seconds, watching for patient effect. So in this case, I would hope to see that my patient their breathing becomes better, they regain some consciousness. Okay, so I have about a milligram inserted at this point. Once again, if my protocol was 1 to 2 milligrams, I would go ahead and administer the entire syringe, watching for effects. Okay, so I'm at 1.5 milligrams. All right, and 2 milligrams. So I can go ahead and remove my medication, dispose of that properly, and then I'm going to go ahead and open up the line. Anytime you administer a medication, we always want to make sure that we flush out the line. So I'm going to flush it for about 30 seconds. And while I'm watching my patient to see if they've had any changes, after about 30 seconds of flushing, we're going to go ahead and readjust the rate back down to where we want it. In this particular case, I'm going to take it back down to TKO. Make sure that I actually have TKO here. And then watch the patient, make sure they don't have any adverse reactions to the medication. Once again, make sure the medication is doing what you actually want it to. All right, if you have any questions, you'll get a chance to ask in class.